Asian eyelid surgery 7 weeks ago. Scar developed at inner corners, making the crease height too high. Number 1. I had a steroid injection a couple of days ago. Massaging makes my eyelids more swollen and red. Should I keep doing it? 2. My crease height is too high and looks unnatural. Will it go down as time passes further, especially at inner corners? 3. The surgery made my eyelids cover my irises partially. Will it get better? 4. Did my doctor take too much skin, making the tail of my eyes pulled up too high? If so, can revision fix it? I just want to look the way I looked with tapes before surgery.
Thank you for your question. You submitted several photos, and you state in your question that you underwent Asian eyelid surgery 7 weeks earlier, and you have a series of questions regarding the current status of your healing process. First, you state that you had some steroid injections done, which has resulted in making the eye more red, and you're wondering whether it's necessary to keep doing those steroid injections. You mentioned also that the crease appears to be too high, and you're asking, will it go down? You also stated that the eyelid is covering part of the iris in both eyes, and you want to know if that's going to change. And you're asking, did the doctor take off too much skin? And you state at the end of your question that you were hoping to get a result that was like using the tape that you used to create a crease prior to surgery. Well, I can certainly give you some understanding of where you're at without full complete information about what type of surgery you had and the exact details of the surgery. But certainly I can give you some guidance as to how I explain what the healing is like for Asian eyelid surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a significant part of my practice. I've spent a lot of years educating people about the art of Asian eyelid surgery, and certainly I can give you a little bit of sense of how I make a determination, kind of just looking at what your concerns are, starting with essentially the goal of what your eyelids look like with tape. So in the decision-making process for Asian eyelid surgery, the first question I have when I look at somebody and determine that they want to get a double eyelid or a double fold type of or crease formed is there a need to remove skin or remove fat or both? And basically it's a divergence of two choices. One is it going to be a non-incisional surgery or is it going to be an incisional surgery? Now, based on that question about the tape, I would suspect your doctor made the decision to do an incisional operation for reasons that include probably the presence of extra skin. There may have been an opinion that the incisional surgery will maybe work a little bit more for you compared to a non-incisional. Both techniques are valid techniques. It's just a matter of what's likely to be more successful for you. And in terms of what apparently is your surgery, which was an incisional surgery, now the question is about the healing process. So to begin with, whether it's non-incisional or incisional surgery, the key element of Asian eyelid surgery to form a crease is to connect the skin to a muscle called the levator muscle, what you alluded to in your question, the muscle that lifts the eyelid. Now, in doing so, whether it's non-incisional or incisional, there is a tendency to create a fair amount of swelling between the crease and the eyelid margin. And that results in making the crease look high. So that basically addresses your second question, where you're concerned about the height of the crease. So it is I try to explain to all my patients that anticipate that the crease will look too high early. Sometimes people like that, but usually people want more natural looking crease, and so it's likely that the swelling will resolve and the crease will get lower. As far as the concerns about the steroid injection, I'm certain that, or I'm confident that you chose your surgeon based on your surgeon's record of an experience of doing Asian eyelid surgery. So I would defer to your surgeon's decisions as to what justified doing the steroid injection. It is not unusual to have some degree of inflammation as part of the normal healing process. Now, one of the things I do caution my patients about doing, because especially during the first month after any eyelid surgery, whether it's Asian or non-Asian eyelid surgery, the incision can look a little bit red, it could look a little bumpy, it could look thick. And very often people believe that this is the ongoing undesirable result of scarring, sometimes often commonly referred to as a keloid. But I explain to patients that in the beginning, in the first month, when you look at wound healing, this is a time of a lot of collagen placement, a lot of inflammation and processes that can create the incision to make it look bumpy and maybe a little bit red. Now, even with that knowledge, a lot of people take the advice of well-meaning friends and family, and they'll put things like vitamin E or cocoa butter a little too early, and they'll end up causing more inflammation. A lot of these over-the-counter scar prevention creams have preservatives and oils that can actually be irritating. So whether or not you did that, if your surgeon felt that the incision may have looked a little bit more red than they were comfortable with, the steroid injection is obviously of value. Let your surgeon guide you. I think it's very difficult for any doctor to just come in and just make an assessment based on a single snapshot. If you're doing your follow-ups with your doctor, your doctor will be the best judge of how things are going. In terms of the eyelid covering part of the iris, that can be a combination of factors. One is the physical weight of swelling along the margin between the eyelid margin and the crease. The swelling can cause something called mechanical ptosis. A little bit of extra weight on the eyelid, it pushes the eyelid down. Number two, just the fixation onto the levator can have some degree of tethering effect, which can affect the eyelid height, but generally that is temporary and resolves with swelling resolution. And as far as the question that you're asking about, did the doctor take too much skin? Well, generally speaking, with Asian eyelid surgery, I think most doctors performing the surgery tend to be conservative when it comes to taking out skin. I think anyone who does Asian eyelid surgery with any significant frequency basically understands that it's not usually, unless someone is considerably older, it's usually not about taking out a lot of skin. Usually you're taking anywhere from 2 to 4 millimeters of skin in terms of width, and you're taking off enough skin so that you have just amount of overlap of the fold in order to look natural. So the odds are in your favor that your doctor didn't take out too much skin. Again, this is an ongoing discussion between you and your doctor. So I think that the take-home message is continue following up with your doctor and take some and have some confidence in the follow-up process and the management. You know, surgery is a single event, but management afterwards is also important, especially if there's any degree of inflammation or swelling that is maybe slightly outside of the norm. But I think in general, most of your healing process is as expected, and that it's only the dealing with the incisional redness that may be the area of concern that your doctor is clearly monitoring appropriately. So I hope that was helpful. I wish you the best of luck. Thank you for your question.